Hi guys, this is Ira again, and today I am here with you as a sophomore student of Central Scholar University Manila, and right now I will be introducing to you the trigeminal nerve. The trigeminal nerve is one set of the cranial nerves in the head. It is the nerve responsible for providing sensation to the face. One trigeminal nerve runs to the right side of the head, while the other runs to the left. Trigeminal derives from the Latin word tria, which means three, and geminus, which means twin. After the trigeminal nerve leaves the brain and travels inside the skull, it divides into three smaller branches, controlling sensations throughout the face. First would be the ophthalmic nerve, the superior and smallest division of the trigeminal. This is the first division of the trigeminal nerve. This is also a sensory nerve. This is the smallest of the three divisions of the trigeminal, and this arises the upper part of the semilunar ganglion as a short, flattened band passes forward along the lateral wall of the cavernous sinus. And before entering the orbit through superior orbital fissure, it divides into three more branches, the lacrimal, frontal, and nasociliary. The lacrimal nerve is the smallest division of the ophthalmic branches. It enters the orbit through the lateral parts of the supraorbital fissure, and it supplies the skin of the upper eyelid, the lacrimal gland, and the conjunctiva. The second would be the frontal nerve. This is the largest ophthalmic division. It enters the orbit by the supraorbital fissure too, and because this is the largest, it also has two branches, the supraorbital nerve and the supratrochlear nerve. They supply the skin of the upper eyelid, the frontal sinus, the scalp, forehead, inner angle of the eye, and the root of the nose. And lastly is the nasociliary nerve. This is the intermediate size among the ophthalmic divisions. It is also located between the two heads of the lateral rectus muscle. It also has four other branches. First is the short ciliary nerve. It supplies the ciliary ganglion, the ciliary muscles, and the iris. The second is the long ciliary nerve. This supplies the eyeball. The third is the anterior and posterior ethmoidal nerve. This supplies the ethmoidal sinus and the sphenoid sinus. Fourth is the infratrochlear nerve. It supplies the dorsum of the nose and the lower part of the nose. And now let's proceed to the second branch of the trigeminal nerve. This is the maxillary nerve. This originates embryologically from the first pharyngeal arc, and its primary function is sensory supply to the mid-third of the face. This originated in the middle region of face as illustrated, nasal mucosa, maxillary sinus, palate, upper teeth, and gums. The function is sensory touch, temperature, and pain sensations from lower face. The maxillary nerve branches into five divisions. First is the meningeal nerve. This supplies the dura mater, and its location is at the cranial cavity. Next is the sphenopalatine ganglion. Its location is at the pterygopalatine fossa. The ascending is orbital, and under that is the periosteum of the orbit, sphenoidal and ethmoidal sinus, secretory fibers of lacrimal gland. The posterior is pharyngeal. Under that is sphenoidal sinus and roof of the pharynx. Fourth is the internal, and it is nasal. Fifth is descending and is palatine. In the internal, through the SPF, the lateral posterior superior nasal nerve supplies the superior middle nasal conchae. The medial posterior superior nasal nerve enters the incisive foramen, connected to the nasopalatine nerve of Scarpa, supplying the lingual aspect of upper anteriors, the premaxilla, and the mucoperiosteum. In the descending, on the other hand, it passes through the GPF, which becomes a greater palatine nerve that supplies the hard palate and the palatal alveolar plate. And then it passes through the LPF. The middle palatine nerve supplies the palatine tonsils. The lesser palatine nerve supplies the soft palate and the uvula. The zygomatic nerve, or infraorbital foramen, is located at the pterygopalatine fossa. Passing through the zygomatico-temporal foramen, the zygomatic nerve supplies the skin on the anterior temporal region, and passing through the zygomaticofacial foramen, the zygomatic nerve supplies the skin on the outer surface of the cheek. The posterior superior alveolar nerve, on the other hand, is located at the pterygopalatine fossa. And lastly, though not the least, is the mandibular nerve. It is a terminal branch of the trigeminal nerve along with the maxillary and the ophthalmic nerves. It has a sensory role in the head and is associated with parasympathetic fibers of other cranial nerves. Its function is sensory, touch, temperature, and pain sensations from, and the motor is mastication. The origin is inferior region of face as illustrated, anterior 2/3 of tongue but not taste buds, lower teeth and gums, floor of mouth, dewar matter, and in motor, it's pons. The termination, sensory pons motor, anterior belly of the gastric, masseter, temporalis, mylohyoid, and pterygoid muscles, tensor tympani muscle of the middle. The cranial passage is foramen ovale. The mandibular nerve supplies the teeth and gums of the mandible, the skin in the temporal region, part of the auricle including the external meatus and the tympanum. The lower lip, the lower part of the face, muscles of mastication, mucosa of the anterior 2/3 of the tongue, the mucosa of the floor of the mouth. And that's it! Thank you for spending a little of your time with us today and learning, and we hope to see you soon.